I am Milwaukee County Executive David Crowley, and I'm currently sitting in the call center for the Milwaukee County Crisis line with Christina Holloway, a Milwaukee County Mobile Crisis Clinician with Milwaukee Mobile Crisis. Now, Milwaukee Mobile Crisis is a team within Milwaukee County Behavioral Health Services who supports callers on the Milwaukee County Crisis line. And as they continue to expand their community-based crisis intervention services, it's crucial to make sure that we equip this team with more clinicians who can assist Milwaukee County residents during their most vulnerable moments, which is why Milwaukee Mobile Crisis is actively recruiting more individuals to join their team. I'm touching base with Christina today to discuss not only her experience as a mobile crisis clinician, but the impact that she and her fellow colleagues are making in the community and the compelling aspects to joining the team. Thank you for joining us, Christina.
Thank you.
So happy to have you. Now, can you tell me, how long have you been a clinician for Milwaukee Mobile Crisis?
So I've been a clinician on the team for about 5.5 years now. The last 2 years I've been a lead clinician on the team, so handling some administrative work and still being available to go out into the community.
We truly appreciate your service. Now, can you tell everyone just a little bit more about the Milwaukee Mobile Crisis and some of the services that you all provide?
Sure. So our team is comprised of clinicians from various backgrounds. So we have psychiatric nurses, social workers, counselors, marriage and family therapists, and we provide crisis intervention services for people of all ages throughout Milwaukee County, 365 days a year. So we provide over the phone and in person mental health assessments. We work to try to stabilize crisis situations. We educate them about the mental health resources that are available in the community that they may not be aware of. We provide follow-up services as well.
Well, it sounds like you all do a lot, so I just have to ask, what made you decide to go in this line of work?
I have always been interested in working in this field of mental health. I always dreamt that I'd be a psychologist. It has not happened yet. But I've always been compelled to work with the community, and I've done that the last 15 years in case management settings, corrections, outpatient mental health treatment. But there's something very unique, I'd say, about the mobile crisis team. Just the idea of families welcoming you into their homes when they're most vulnerable and allowing you in that space. I'd have to say that there's something very humbling about that.
Absolutely. Now, I can only make assumptions about what the process looks like when someone makes that call, but Can you tell everyone, what does the process looks like for you when someone makes a phone call to the mobile crisis line?
Sure. So once someone makes that call, what we do is figure out what is the situation. So we gather the pertinent information. We provide a safety assessment at that time. Is there an imminent risk of them harming themselves or someone else? Because that may garner a different response. We do an assessment over the phone, like I said. We ask them how we can be of service and support to them, just so that they feel empowered with deciding what that next step is going to look like. We offer to meet with them in person, and if they're open to that, then we dispatch a team. We usually work in pairs. We go out, meet with them, figure out what's going on. What are the mental health symptoms that they're presenting with? What triggered this particular crisis today? What are some coping skills that we can talk about and build on to help them? That way, if they're in this situation again in the future, they'll know what to do to manage that crisis. Again, we educate them about the services that are available in the community. And it's not always connecting them with a mental health provider. It could be connecting them with a peer support specialist or some other program that's available, wraparound services or some type of case management level. So really figuring out what they need to help stabilize them in the future.
Now, you're kind of alluding to this, but what are some of the reasons why individuals may actually call the crisis line?
A variety of reasons. So sometimes family members are calling with concerns about loved ones and just not sure of the steps to take. We have individuals who will call and say, I have a child who's experiencing suicidal thoughts. I'm not sure how to have that conversation with them. So we'll work through how to initiate that conversation. Professionals called to consult about clients. Law enforcement will call us to consult about individuals that they come into contact with. People will call because they want resources for themselves. They want to know what are the different levels of mental health treatment that's available in the community. So everyone knows about inpatient, but there's partial hospitalization and day treatment and intensive outpatient. So providing them that information so that way they can make the best determination for themselves.
Absolutely. Now, do these callers always find themselves in an immediate mental health crisis, or could it be varying reasons as to why they are calling?
No, not necessarily. And we want to stress that you don't have to call just when you're in crisis. Call us before things get to that point.
Absolutely.
If you feel like you're just having a bad day and you just want to talk to someone about it, pick up the phone and give us a call. Again, if you want more information about resources that's available, give us a call. We can provide you with that information. If you're not sure, call us. It's a great starting point to have that conversation. So no one has to be in a crisis.
Now, how many calls are you receiving on a daily basis?
Oh, I'm not sure of the day-to-day amount. I'd say annually over 30,000. I could have a day where I'm fielding 20 calls myself. So I don't know how many.
Okay, that's not a problem. Now, when you think about some of these calls, just in general, do they always result in you having to travel and go somewhere and meet with the individual, or sometimes can you have a conversation over the phone?
Absolutely. We come across individuals on the crisis line who are more comfortable talking over the phone, and that's okay. We can still provide high quality services that way, telephonically. We can do those mental health and safety assessments, needs assessments. We can de-escalate crisis situations over the phone. So it does not have to be that we have to come to your home. And I definitely don't want that to be the reason why someone doesn't call, because they don't want us coming out. We can definitely talk over the phone.
Absolutely. Now, what are the benefits of this type of approach versus sending someone to an emergency room or to a hospital?
I say one of the benefits is that we are responding to them in the community. We're meeting with them at their home or some other place that they've determined is most comfortable and safest for them. And I think when people are in that type of environment, they tend to be more open and honest about what they're struggling with. They tend to pay more attention to how can I set myself up to not be in this situation again. Mm-hmm. They're more apt to follow through with going out to access mental health treatment on their own. Excuse me. So I say that's the benefit. Of course, cost effective, rather than getting a huge bill from a hospital. So I think those are the benefits. But what tends to happen is that people go the route of what they're most familiar with. So if I'm always used to going to a hospital, even if it's not necessary, that's what I'm going to turn to. So it's important for the community to know about our services and know that we are here to provide those in-home assessments mm-hmm. and provide them with the necessary information.
Awesome. Now, what kind of experience have you had, particularly on a call, that relates to a positive impact on somebody's mental health?
Okay. So we recently were requested to assess someone at a school, a young man. He was struggling with suicidal thoughts, and that was new for him, so it scared him, which is why he spoke up about what he was going through. So we went out. The father provided verbal consent for us to meet with him. And he was initially guarded, so we had to find a different approach to build that rapport, and luckily we did. Football was the key there. And that guard came down, and he opened up about what he was going through at home and being bullied at school for various reasons, and just provided an opportunity for him to be honest. I felt like he had been bottling all that up until he reached that point, and it scared him. He wasn't used to having those suicidal thoughts, and for him, that made him think that he needed to seek hospitalization. I'm having these thoughts, I need to go in right away. But by the end of that conversation and us talking about coping skills and providing him with information about community programs like Running Rebels, they've been around for a long time. Mm-hmm. So connecting him with those other services, he felt more comfortable with the idea of not going into a hospital and utilizing those other resources that we provided him with. We provided a follow-up call with him the next day. He did not answer. So I sent him a text, remembering that this generation probably responds better to a text. So he did respond. He said that he was doing better. He was not having any suicidal thoughts. Talked about some of the coping skills that he was using, which one was drawing. So he sent me a few pictures of his sketches. So that's one example where we had a positive outcome. And I think that is hard, especially for youth, to consider even speaking with someone like us, right? They're being hit with so many negative influences right now. So the idea of reaching out to us, not likely, but he was happy that he did, and I'm happy that he opened up to us and gave us the opportunity to connect with him.
We appreciate all of your work in doing exactly that. And we think about the impact that we have, particularly on those that we serve. When I think about that encounter, the question comes to me is, how did that particular encounter personally affect you? And did it reinforce the fulfilling and the rewarding work that you're currently in?
Sure. For me, I have, people in my life around that age. So, being concerned with what they're going through that they're not opening up to me about, and having those conversations with them. After I met with that young man, I reached out to one of my nieces who was the same age and just like, hey, just remember that I'm here if you want to talk. You don't have to keep things in. There's no judgment. Let's just have a conversation about what you're going through. It always hits home on some level. And I think that when we have those experiences, it reminds me of the purpose of this team, the purpose of why I went into this field.
Absolutely. And I can just imagine this particular field isn't necessarily easy, right? And so,
no.
But what kind of support system do you have with your team members? And even when you think about Milwaukee County, how is it working for an organization, a government organization like Milwaukee County? And what is the benefits for individuals when you think about recruiting your next colleague?
Definitely. Right? I'd say what's really great about our team is that we lean on each other. We dealt with some tough cases day in and day out, and we're always available to debrief, to let's just have a minute where we take a breath, let's talk about it, let's process what just happened. And even our leadership. So when they say they have an open door policy, they truly mean that. So if I need to connect with one of my supervisors, I know Michelle or Hannah will take the time to discuss the issue with me, to talk about what I'm struggling with, what I'm going through. And if they're not available, even the director, Lauren, I know if I knock on her door, if I call her, she'll make herself available to process the tough situations.
Awesome, awesome. What type of qualifications are required for interested candidates and the key attributes needed that contribute to the success of this type of role?
So we're looking for applicants who possess a master's or bachelor's degree in psychology, social work, counseling, or some related field. For those who have a bachelor's degree, we do ask that they're either pursuing a master's degree and appropriate licensure, or that they have at least a minimum of 3 years of practical experience in crisis. Okay. We are looking for people who are quick on their feet, who can walk into a chaotic situation and still be calm, still maintain composure. We want people who are aware of the struggle out here and the importance of us connecting with those who need mental health services. They need to be passionate, and that has to come through. It has to be genuine, because when you're not, trust me, clients will know and they will call you out on it. So we want people who are dedicated and committed to providing these services for the community.
That's awesome. That's awesome. Well, those are all the questions that I have, Christina. Okay. I'm glad that you were able to join us. And Christina, it's been an absolute pleasure talking with you and getting to know more about your role, but your colleague's role also with the Milwaukee Mobile Crisis. And so I truly appreciate the work that you are doing for our entire community. Every member needs to make sure that they get access to mental health and making
Absolutely.
sure that they can get over those struggles. So for those who are interested in potentially starting a career with Milwaukee Mobile Crisis, I want to encourage you to visit mkemobilecrisiscareers.com. Again, that is mkemobilecrisiscareers.com. And I just have to mention that the team is offering some great incentives for anyone who's interested in joining the team. We're offering a $7,500 sign-on bonus for full-time clinicians, $3,500 sign-on bonus for part-time clinicians, and impressive differential increases for second, third, and weekend shifts. But I have to say, I am really pleased to not only be able to help spread this awareness, but also to help the Milwaukee Mobile Crisis and gaining more clinicians in all the work that you do all across Milwaukee County. We truly appreciate
Thank you.
your service.
Thank you.
Thank you.